When you become ill in a country where you don't speak the native language, the immediate challenge is accuracy. You know exactly where it hurts, but you lack the specific vocabulary to tell the medical staff. To solve this, we will look at two specific sentence structures that allow you to communicate localized pain to a German doctor. Before you speak, you must choose the correct facility. For standard ailments like a cold or the flu, you visit a Hausarzt, a general practitioner. The Krankenhaus, or hospital, is reserved for emergencies or after-hours care. At the front desk, the Anmeldung, you are required to present your public health insurance card before you are seen. Navigating these administrative steps correctly ensures that when you finally see the doctor, the focus remains entirely on your symptoms. Inside the examination room, the first step is identifying the body parts involved. In German, this requires sorting them by their grammatical gender. First, masculine parts use der, head, throat, arm, stomach, back, and foot. Neutral parts use das, eye, ear, and leg. Feminine parts use die, the nose and hand. In the plural, eyes, ears, hands, or legs, all parts use the feminine die, regardless of singular gender. Categorizing these body parts correctly is necessary because the sentence structures we use to describe pain rely on these specific genders. The most direct way to express localized pain is to use a compound noun. The structure begins with ich habe, I have, followed by the body part attached to the word Schmerzen. For example, combining the word for head, Kopf, with Schmerzen gives ich habe Kopfschmerzen. Similarly, using the word for stomach, Bauch, results in ich habe Bauchschmerzen. This method is effective because it allows you to describe a specific ache using a single noun, without needing to conjugate additional verbs. A second, more common way to describe pain in German uses the verb weh-tun, which literally means to do hurt. This structure follows a specific order: a possessive pronoun, the body part, and finally the phrase tut weh. For masculine and neutral parts, use the pronoun mein. No letter is added to the end. This forms sentences like mein Kopf tut weh or mein Rücken tut weh. For feminine parts, add an e to the pronoun, making it meine. For instance, if your nose hurts, you would say meine Nase tut weh. Using this structure correctly shows the medical staff that you can accurately apply German gender rules to your symptoms. A common mistake occurs when pain involves more than one body part. The verb must change to reflect the plural. Use tut for a single part, but tun for multiple parts. Adjust the pronoun to meine and the verb to tun. For one leg, mein Bein tut weh. For both legs, meine Beine tun weh. For both ears, meine Ohren tun weh. Ensuring the pronoun and the verb match the number of body parts mentioned prevents grammatical confusion during your consultation. You now have the necessary structures to navigate a consultation with a German doctor. Let's practice with a specific example. If this patient wanted to use a compound noun to describe their sore throat, what would they say? The answer is ich habe Halsschmerzen. Now, using the second structure we learned, remembering that Hals is masculine, how would they describe the pain? The answer is mein Hals tut weh. Once you have communicated your symptoms, recovery often starts with a simple German recommendation: Tee mit Zitrone, hot tea with lemon.